Thank you so much for joining me today. This is something that we have started doing every month. Once a month, we do a Zoom call, and it is purely education because I am very, very passionate about the fact that when people think they have chronic pain, a lot of times people feel that they have lost hope. And so my hope is that people will know that there is a chance of getting better. So my name is Joanne Pong, for those who have not met me yet. Okay. So I am a physical therapist, but specifically, I am a chronic pain specialist. So most of my patients are the ones that have tried everything. They've tried injections, they've tried surgery, physical therapy in a traditional setting. They've tried, whatever else, like chiropractor, injections, multiple revisions of whatever surgery they have. And they're still dealing with pain. And in fact, a lot of them will say it seems that the pain is spreading. So if they have a back problem, eventually it becomes a knee pain, and then there is the neck, and then the shoulder. And so that is typically not because you have arthritis in every joint. Yes, there is such a thing, but a lot of times when you're dealing with chronic pain, it's the fact that you have compensations because you've been living in pain. And when you have compensations, you become lopsided, and in the process, your body is no longer able to function the way it's designed to. And so those pains are spreading, because I don't know if you realize this, but pain is just an alarm system. It is just the body's way of communicating with you. Whether it's a gas pain, if you notice when you have gas pain, how do you know you have gas? It's because your stomach hurts, and then you get rid of it, and you get rid of the gas and the pain goes away. Or you've heard of people who have a broken arm or a broken leg and it's excruciatingly painful, but once the bone heals, pain goes away. So just a little background, when it comes to chronic pain, if I split you in half and one side of you functions differently than the other, in other words, when you become lopsided, so that the body is no longer capable of moving, walking, sitting, or sleeping the way it's designed to, then how does the body tell you that something's wrong? It's going to tell you by hurting you. That's what that does. When you look at it from that perspective, you realize that all pain we have does not have to be about bulging disc. It does not have to be about pinched nerve. It doesn't have to be about bone on bone. Granted, those things can trigger a problem, but it doesn't mean that that's the only problem you have. So today's topic is about the back and the hip. The reason I want to share that with you is there is such a connection between the two of them. And I'm for about 3 to 4 years, I have been doing sort of like a consultation with a hip doctor, a hip and knee doctor who is quite reputable in Sarasota. And every Wednesday, I used to, work alongside a PA just so I can give my perspective. They give the bone perspective because that's what an orthopedic doctor does, or a surgeon, and I do the muscular component of it. And so because I'm there all the time, I get to hear their opinion, right? And so what I found very interesting was the spine doctor will send them, will send the patient, will refer the patient to the hip doctor because they say it is not your back, it is your hip. And then once they go and see the hip doctor, which is usually when I see them, then the PA or the orthopedic doctor will say, well, it is not your hip, it is your back. So you got to go back to them and to your back surgeon. There is this frustration because people are like, well, I don't know what it is. They're moving me back and forth, and so they don't necessarily know, what the problem truly is. And here I am, I'm listening to this and I'm thinking, Are you serious? Is it truly a question of whether it's a hip and a back? The truth of the matter is that they are connected. And that is what today's conversation is about. Okay. So instead of looking at, is there a bulging disc or is it a bone on bone? I want you to realize that there is a huge muscle component to it. And the reason for that is there are only 206 bones in the body, yet there are over 600 muscles. So why is it that muscles are never talked about as much? Or when we even talk about muscles, we talk about strength. Like, oh, I'm weak. My core is weak. I need to strengthen my core. I'm not saying that having strong core does not help, but if you are lopsided and you strengthen your core, guess what happens? You might be stronger, but you're still lopsided. So in other words, you may feel stronger, but you're still having the pain because your body is still trying to tell you that you are still lopsided. Okay? So to explain a little bit about what is it, why does the muscle cause pain? I don't know if you realize this, that muscles are attached only on both ends. Okay? They're attached on both ends, but the middle part is free and floating. Okay? So for example, if this is your muscle, it is attached here and it is attached in the scalp. Now picture that your muscle is tight. What happens? It's going to tug, right? So if it tugs, where is it going to hurt? It's not going to hurt here, right here in the middle. It is going to hurt at the attachment. So that is why if you focus on muscles, or at least look at it from a muscular perspective, you are going to realize that you can get some pain relief just trying to correct that rather than think, oh, I'm going to have injections, I'm going to have PRP, or I'm going to have surgery. I'm sure you have heard, if whether it's you who have had this experience or you've heard it from people where they say, I've had back surgery, but I'm still in pain. And the scary part is I know of some back surgeons who will say, well, there's a cyst there or there is something off, let's do it again. The reason that the surgery, whether it's a hip replacement or a back surgery, the reason for the lack of the desired outcome is not necessarily because the doctor messed up. In fact, I have rarely encountered that. The reason for the lack of outcome is because before you decide to have surgery, you've been putting it off because you always want surgery to be your last resort. And in the meantime, as you're putting it off, you're looking for different ways to resolve this problem. Then you are compensating, you're limping, you're moving slowly, you limit your activities, you modify your behaviors because you've been living in pain. And so then you finally have surgery, right? And then you're still in pain. You still can't walk. You still can't sit comfortably. You still can't sleep comfortably. Well, the reason for that is after they fix your spine and after they fix your hip, now those things are working properly. But if they're working properly, but the rest of your body can't work properly, guess what? Your body is still going to set off the alarm system and say, hey, you may have fixed the spine, you may have fixed the joint replacement, or you may have had a joint replacement, but you're still not capable of walking because you're still lopsided. I'm going to give you some examples of where you would have pain, and it will give you an idea of what muscles are involved, okay? But before that, I do acknowledge there is such a thing as bulging disc, there's such a thing as herniated disc, spinal stenosis, spondylolisthesis. That spondylolisthesis is the one where if this is your spine, one of them is kind of slipping forward. So anytime that happens, the doctor wants to fuse it to prevent it from slipping forward. Believe it or not, there is a muscle that is pulling it forward. So if that muscle is corrected, that means this is not going to get worse. Because as far as I'm concerned, I know fusion is common, but when you fuse something, I even hear surgeons who warn you that very likely in a few years, they're going to fuse the top, right? And then after that, they're going to fuse, farther up. So before you know it, from the neck to your tailbone, you are fused. And believe me, I've met some of those. Okay. So, but I do acknowledge they do exist. Glute med tear is very, very common. Osteoarthritis, trochanteric bursitis, sciatica. There is also such a thing as SI dysfunction. Okay, that is to me one of the least diagnosed problem, and yet it is actually very easy to solve. Okay, so what is SI dysfunction or sacroiliac dysfunction? A very common symptom of that is, let's say you sit for about half an hour, okay? And then you are going to get up, and in the process of getting up, you are going to go, ugh, and then you have to stay there because everything hurts right up in the back. And then after that, you are going to, the first few steps are going to be painful, and then somehow it gets better. Why is that a very commonly undiagnosed problem? It's because you can't really see that on x-rays or MRI. They may say that it's arthritic, but then they just shrug it off as, oh, your SI is arthritic. Okay. SI, if I'm going to turn around so I can show you. So if this is your sacrum, if you recall, this a triangular bone, and then it is connected to your hip bone, right? So that is a sacrum. This is called the iliac. So that's where the I is coming from. SI, it is that joint. Now, why is this relevant? Because when the whole body weight gets transferred to the legs through this joint, people think it is transferred at the hip. No, it passes through the SI before it reaches the hip. And so when that SI, which is practically, there's practically just two bones, kind of tilted, but they're practically two bones that are just stuck together. So when that is misaligned, okay, it either misaligns that way or the other way. In other words, it can go backward or it can go forward. If the SI joint, if the bone shifts forward, guess what happens to the leg? It becomes longer. If it shifts backwards, it becomes shorter. It does not mean that you have a leg length discrepancy. It doesn't mean one leg is shorter than the other. It just means that the SI is shifting. And because it's shifting, you have this temporary shortness of your leg. Okay. Now, I have heard of so many people who say, I have one leg longer than the other. And so my chiropractor gave me a shoe insert. That is well and good if that is a true leg length discrepancy. But if you have an unstable SI joint, you are just going to encourage the problem. Okay. So if you are using that and you're still having problems, I want you to consider that if it's not helping you, then maybe you shouldn't be using it. Okay. And if you have that kind of a situation and you want to know more about it, then I'd be happy to talk to you on the phone, even just to make you understand it more. Okay. Now going back to, yes, I acknowledge those diagnoses exist, but when you are living in pain beyond 3 months, you already have the consequence of the compensations. And so you are no longer just dealing with those diagnoses that I have mentioned. Rather, you are also dealing with the consequence of the compensation. So now we're going to, like one at a time, kind of give you an example of why is it that some people say it's not too bad sitting. I just heard walking, okay? Or I can sleep, but I can't walk. And they have let's say they have a bulging disc. Now, you talk to somebody else and they have the same diagnosis, but they can do the opposite. They can sleep, they can't walk. Some others can't walk. In other words, just the opposite. Okay. So the question is why? If they have the same diagnosis, why do they have different problems? Well, I'm going to explain it to you from a muscular standpoint. So remember what I said, okay, that is attached to here and that's why it tugs, okay? So I'm going to give an example of people who find it very uncomfortable to sit, okay? So from a muscle standpoint, the biggest problem there is your glutes max, your buttock muscle, okay? There are other problems, obviously, but I'm trying to simplify this to make you understand that muscles really come into play with chronic pain. So let's say this is your glutes max, okay? It attaches right here. So this is the initial attachment. And then this is the bottom attachment right here. In fact, it kind of goes like this, okay? And it kind of goes like that. So if this is tight, okay, so then it kind of shrinks a little bit, right? It's tight. And you are going to sit down. So when you sit down, you are going, I'm going to go in this direction so that you can see me on this side. So when you sit down, watch what happens to the glutes max. You have to stretch it. So if it's tight and you have to stretch it because when you sit, you have to stretch these muscles, then guess what? It will be uncomfortable right here because this is the attachment. That is where it's going to tug. So then when that happens, guess what? You have the urge to stand up because you are trying to stop it from tugging. Okay? All right, I'm going to give you another example, but this time it's for people who struggle to stand up. Okay, so they sit and they just go, ugh. Or they may be walking and they're walking kind of like this, right? And they're kind of walking like this. And the spouse or a friend would say, "You're looking like an old person, stand up straight." And they're like, "I'm trying, but it hurts," right? So I'm going to give you a very common, even regular people would hear about this. It's called the iliopsoas, okay? So that's actually two muscles. It starts from right here, okay? So it starts right here, but that is a diagonal muscle. It actually goes, just imagine that this is straight, okay? And it attaches to the front of this bone, the iliac crest. So imagine that that is attached there. That is the ilio part, because you know how I said there are two muscles, iliopsoas. So that's the ilio part. Now the other one starts from here still, but it goes straight to your entire lumbar spine. There are 5 lumbar spine, L1 to L5. So just picture that they're diagonal muscles, okay? Now picture that they're tight. And one of the most common reasons they're tight is because we sit a lot, okay? Because guess what happens? If this is the muscle, okay, and you are going to sit, now you shorten the muscle, okay? That's what happens. You shorten it. Now remember, this is the attachment, the back part. So now you're going to stand up. Now picture that the attachment is right here, and you are going to stand up. You have to stretch this muscle. So guess what? You are trying to stretch it. And in the process of stretching it, it's going to tug right here. And then after a while, it takes a moment, and then eventually the muscle relaxes, and you're like, ah, now I can move. Okay? Now, the other thing why this is so significant is if this muscle is tight, especially the psoas part, the one that attaches in front of the spine, what happens when that is tight? It is going to tug at L1 to L5, right? And so if it tugs and it's continually pulling, what happens to the vertebrae? especially if just one part of it is tight. It is going to, if this is the muscle right here, right? I'm facing this way, so if that's a muscle, and this muscle is attached to the vertebrae, the bone, it is going to pull it forward. You see that? It's going to pull it forward. So if you or when you understand that muscles play a huge part, because the muscles will actually move the bones. Okay, when muscles are tight, it will move the bones. However, if you, and I have absolutely nothing against chiropractors. In fact, I collaborate with them sometimes. But picture this: if the chiropractor moves the bone, but you don't do anything to the muscle, guess what? It is going to move back. The muscle is going to pull it back. And that is sometimes why you keep going back, and because it's a temporary relief. Okay. Any stretches or self-release to the QL muscle. Okay. So the QL muscle is very critical of when you are trying to pick up something and it hurts. Okay. So I'm going to tell you why. We have our rib cage right here, right? And we have our pelvis. And in the back, the QL muscle, I'm oversimplifying this again, okay? But the QL muscle is literally connecting the two. So here you are. Here is right there. That's the attachment at the base of your rib cage. And this one is right here, okay, at the bottom or the top part of the iliac crest. So that's the QL. Now imagine that you are going to bend, okay, as in picking up something. So when you bend down and that is tight, you are going to have to stretch it, and you're like, I can't do it, it hurts, because it's tugging at the attachment, whether it's here or here, okay? Another, one of the ways to know that you also have a QL problem, when you have a hip or a back problem and you are shifted over, okay? So like, let's say you're shifting that way, okay? This is the muscle that gets tight. And so if one of them is tight, it's gonna push you over, okay? So now looking at this position, okay, and you will know that you are in this position when you stand in front of the mirror, because when that is shifting, you will see that there is a narrower gap here and there is a wider gap there. Anytime you see yourself doing that, that means that the hip is actually shifted. See what I did? Okay, so that means you have a QL problem. Now, that one I can safely tell you what to do. And one of the ways to do it, I don't know if you're familiar with fascia, okay? With chronic pain, fascia is critical. Fascia is, when you look at a piece of steak, it's the marbling. And the marbling actually connects you from head to toe, just like our skin. So the simplest way to explain it is, it's, that's it. It's like skin under our skin. So when you are compensating a lot, okay, you inadvertently twist your fascia, okay? So what that means, imagine it's like skin. So if your fascia is twisted this way, and then the other end is twisted the opposite way, guess what? Imagine how uncomfortable it is to be walking like this with a twisted pair of pants and a twisted shirt. So if you untwist it, so if you're walking like this, and then you have the means to actually untwist it, you will notice that you can move easier. Now that is just the fascia. So if you have tight muscles, that will also, that will actually pull it right back. So I'm going to give you a couple of exercises, because I always appreciate it when people ask me questions, because that is a great way. If you have a question, I'm sure somebody else has that question. So anyway, for that, So this is one of them, okay? So we call it tie the shoe, okay? So you're gonna sit in a regular chair and do not sit close to the edge, okay? Because we don't want the chair to tip over. But from this position, you're just sitting comfortably, not all the way back, kind of like midway, but not on the edge. And you are going to pretend that you are going to tie your shoe. Okay, so you're going to pretend that you're going to tie your shoe, and it doesn't mean that you are going to go all the way down. It is always about how far you can do it. So if you can reach down here, but over here you can only go so far, that is perfectly fine. Okay, so what am I doing when I ask you to bend? Guess what? I am stretching that QL. There's 7 layers of muscles in the body, so there's much more benefit from doing this than you realize. But whichever way, if you test both, whichever way is easier, that is what you are going to do. So that is so counterintuitive, because a lot of times when you feel like something is tight, guess what you do? You actually stretch the tight side, right? That is well and good if your fascia is not twisted. But if it is, you're actually twisting your fascia even more. I'm going to explain that to you using my shirt, okay? So for example, this is the fascia, and you are going to test this, and let's say going to the right is tighter. That means that at this level, okay, your fascia is actually twisted towards the tight side, okay? And so if you go into the very common idea that if it's tight, you're gonna stretch it that way. From a fascial standpoint, guess what you're doing? You're actually twisting it even more, okay? That is why you keep stretching something and you don't understand why it's not getting better. So the way to do it, again, I understand it's counterintuitive, but I just want you to give this a chance, okay? So you test it before you do the exercise. Whichever, like in this case, the left side is, for example, easier. That means you're actually going to bend down, okay? So you're gonna bend down, and I don't want you to stretch too much. No pain, no gain does not work for chronic pain. Okay, I cannot emphasize it enough. Because when you're overstretching something, you are not actually moving your fascia. You are stretching your muscles. Now, remember, if your muscles are tight and you force it to stretch aggressively, your brain is going to think that it is being injured. And so if it feels like it's being injured, guess what the body does to protect itself? It will tighten it back up. And that is the reason why people who are stretching aggressively, they're gung-ho about it, they don't understand why they're still tight. Less is more when it comes to stretching, especially when it comes to chronic pain. So going back to this, so what you're going to do is you're just going to go where it's comfortable. You are going to hold your leg so it doesn't put so much stress on your back. And you are going to stay there for 20 seconds. If this is too much, you can do it this way. It doesn't matter to me, just whatever you can tolerate. Hold it for 20 seconds, okay? And then once you do that, you come back up, and believe it or not, you're going to repeat it on the same side. You are not going to switch over. The second time has to be on the same side, okay? And then once you're done with that, on the tight side, you are going to do it once. You are going to notice that there is a 5% change for the better, okay? Because what happens then is you were twisted originally, and then you just untwisted yourself. And so now that you're untwisted, it is free to move again. There are so many ways that you can do exercise that way. In fact, if you want to give it a shot, I highly encourage it, looking at it from that perspective. Okay. In other words, try to untwist your fascia. And if you are skeptical about it, I want you to at least have an open mind. do it once, and then you do a retest. And if the retest is better by 5%, it's not going to miraculously disappear. But if there is a change for the better by 5%, that is telling you that the fascia itself is twisted. If there is absolutely no change, that means that the actual muscle is tight, but it doesn't hurt to still stretch it. And then if it actually gets worse, that actually means you chose the wrong side. So if you chose the wrong side, it's very easy to undo it. You just go to the opposite direction and you do it one time only, and that should get better. So I know that that is such a counterintuitive thing, and that's the reason why we like to especially educate people, but not only educate, but also make you understand the why behind it.
I have MS and I sit a lot. So when I sleep, I always sleep in like the fetal position. And that's what kills me at in the morning when I get up. So I have that pain when you stand up. So then I'm thinking maybe it's the SI joint. But I know when I do pelvic tilts, that really helps when I push my back to the bed.
Got it?
So I don't know, would it be the SI or the QL? I've had the ablation. I just had that. It
Mm-hmm.
did absolutely nothing.
Mm-hmm.
So I know it's muscular. I
Yeah.
just don't know which one it is. And
So
I
it
can,
is, I'm sorry, go on.
and it's not the fascia because I can go down on either side. That's no problem.
Right. So I'm going to tell you right now that the QL is not your problem. Okay. And here's why. Let's say you said you are sleeping in a fetal position, right? That means, guess what? If you are sleeping in a fetal position, that actually means that you all night long you are stretching your QL. The problem that you have is actually that the iliopsoas is tight because all night long you are in a curled position. So you remember how the attachment is from here to here. So now you've shortened it. So when it's time to wake up and you are trying to stand up and uncurl yourself, now you can't do it, right? Now, why is pelvic tilt? That actually makes so much sense that pelvic tilt helps you. And the reason for that is when this is tight, it forces the pelvis. I'm going to use my phone as a pelvis, okay? So here is a pelvis, okay? When the iliopsoas is tight, remember the attachment is from here to here. So it is going to pull, it's going to make the pelvis tilt forward, knowing where the attachment is, right? Does that make sense? So it is going to tilt it forward. So guess what? When you get up, the urge to do is to do a pelvic tilt, which is to go back, right? So without you realizing it, the body was telling you what to do, right? And that is actually something that I find very important. When I see patients here, there are three things that I'm interested in. One, exactly where it hurts. I'm not interested in it's the back. I am interested in is if you are going to use one finger only, where is it? Is it here? Is it here? Is it there? Because that tells me where the tug is, right? So you're essentially pointing to where the muscle is. You're identifying the muscle, or I'm identifying it for you. Now, the second question is, what are you doing when it hurts, right? Is it when you are bending down or as you're standing up? That's relevant because, again, just like I analyzed that it wasn't your QL based on your story, I'm able to figure out exactly which muscle is the problem. Because if you think it's a QL and you've been dealing with a QL for a while, well, no wonder it doesn't work, right? Um, you know how they say that if you do something over and over and it still doesn't work, then you should investigate another way of doing it because clearly if you keep doing it and it doesn't give you and it gives you the same result, which is lack of result, then there is no point in keeping it up. You've got to analyze it differently,
Okay,
right?
so if it's the I guess L or S4-5, and the pain is only standing up, would you do the same? Would you do the same?
I will teach you a different way of doing things now that you've said that. And by the way, the third thing that is very important, in fact, this is to me the one that tells you so much, is when you are in pain, what is the urge to do to make it feel better? Because the body is very, very smart. It will tell you what you need to do. So, for example, if you are standing at a checkout line, right, and your back starts to hurt, you know that the iliopsoas is coming into play because as you're standing there and that's tight, it's going to keep tugging. And so, if the urge is to want to sit down, guess what? You are relieving that tug. Okay? That's what it is. If, for example, your problem is somewhere, in the back or the hip, and you want to like twist, or some people will try to go bend sideways, you should pay attention to that because the body is telling you that is where the problem is. Okay? So that can really help you, as you have to be aware of these three things that I mentioned to you. In fact, with my patients here, I've trained them well enough that on their way to coming to therapy, I hear this a lot where they're thinking, what am I going to say to Joanne? Because they now understand what those three things mean to me. Okay. So going back to what can you do? Okay. So because we've identified that that is I'm going to move chairs around so that you can see me. Okay. So, hold on just a second. I just want to make sure that we're still, okay. I think we're good. Okay. So remember how the muscle starts from here to here. So you want to stretch it, right? So there is what we call a standing hip extension, because we always have to take into account the fact that it could be muscles. I mean, that it could be fascia as well. So we don't just assume it's muscle. We have to take both into account. So imagine that that muscle starts from here and it attaches here. So you're going to stand at arm's length, okay? And I don't want you to go this way. So make sure you're just at arm's length, same distance with your hands and with your feet. It's very, very easy, very, very gentle. You put your hands here and picture pushing your hips forward with your knees straight. So in other words, picture this, okay? It's almost like I'm pushing my belly towards the wall. But instead of doing that simultaneously, you are going to just push one hip more and compare it to the other. So in other words, you are going to push one hip slightly, okay? And then push the other one slightly, okay? But I don't want you to exaggerate. I don't want to see this, because when you do that, you are doing a whole different thing. Remember how I said about less is more? Trust me, it works that way. So don't exaggerate the twist. It's literally just pushing one hip closer to the wall and then doing the other side. Same thing applies. Whichever one is the one that is painful, you do the opposite. Okay? Let's say you do this and you don't have pain. Then that means you go by pull. Which one has a bigger area of pull? And that is the bad side. So if there's pain, automatically that's the one that you need to, that's the bad side. So that means that you got to do the opposite side. But like I said, if there's no pain, then that means you have to figure out which one has a bigger area of stretch. Sometimes you have to pause for a while and you will feel it. Now, what if both are painful? There's another one, right? So if both are painful, is there one that is less painful than the other? Okay. Now, I don't want to confuse you why, but if you find that both are painful, remember the other exercise that I asked you to do, which is I call it tying the shoelace. You do that first. You do that exercise, and after you do that exercise, very likely this is going to improve. That has something to do with the position of the pelvis. Does that help you?
Yes, it does. And what is your view on using a lacrosse ball or a tennis ball underneath your back when you're laying down to stretch it?
Okay, that makes me nervous. I do that here, by the way, but here's why that makes me nervous. Have you done that, by the way?
Yes, but it really hurts my back.
Yeah, but is it helping when you do it?
Not really. It's
Exactly.
it's too tender, so I don't
Yeah,
even think I can put enough
yeah.
weight on it.
So the reason that I don't recommend is not because it doesn't work. The reason I don't recommend it is because you don't know what you're doing, which muscle you're doing. And like, for example, in your case, you're like, oh, I'm going to stretch my QL. Well, if your QL is actually overstretched, guess what you're doing when you use a ball? You are stretching it even more. So you are actually encouraging the problem. Okay. This is a little bit of a different problem, but because I'm sitting, I'm going to give you an example of that. Okay. So let's say you have a neck problem. Okay. And you are hurting here, but when you look at your shoulder, one is actually lower than the other. Okay. So you see how that's one, what that is lower, right? If your pain is right here, you are not tight here because you're tight. You are tight there because it is overstretched. Does that make sense? So the worst thing that you can do there is stretch that, or the worst thing you can do there is massage that. The
Okay.
problem there is the fact that this is tight. And so when this is relaxed, you drop it. And in the process of dropping it, because we're all connected, this one goes up. That is what I'm trying to tell you about the QL. Okay? Does
Okay.
that help?
Yeah, that does make a lot of
Yeah.
sense.
And that is a reason that I don't. I mean, I do it because I understand the body, right? I know which ones to do and which ones not to do. Um, that's all I can tell you. Yeah, I would rather, I think that if you do the stretching the easy side first compared to the other, you will get more out of it.
How long do you think doing stretches, what, two, three times a day before
Very
you
good
would
question.
start
First
seeing
thing in the
some?
morning, that's it. First thing
Okay.
in the morning. So why first thing in the morning? What I find very interesting is people will say, first of all, stretching is boring, right? And then the other one is, I'm too busy. I will do it at the end of the day. Okay. Well, what is the purpose of stretching? The purpose of stretching is to allow you to function better for the rest of the day, right? That's it. Now, if your fascia is twisted and in the morning you take the time to untwist it, guess what? You get to function better for the rest of the day. But guess what? If you're going to do your stretches at the end of the day, that means that during the day, the entire time, you are twisted, the fascia is twisted, it's dysfunctional. And then at the end of the day, you're like, oh, I finally have time after work. I'm going to twist myself. And then after that, you sit and watch TV, you go to sleep. There is no purpose in it. The only time that stretching is beneficial at night is if it is hard to sleep at night. If it's painful, then that would be worth doing. If it hurts to sleep at night, then that would be a good indication. You will benefit from it, but it's not a question of which one. It is the first thing in the morning is a must do. And then the other one is an option.
Is there a recommendation on to sleep? Because whether you sleep on your back, I'm a stomach sleeper and that kills me.
That
Sleep.
is the worst position.
Yeah, I
Is the
know.
stomach.
I know.
But here's the thing, the reason that you prefer it is because your body is now twisted, right? And so if the body is now twisted, when you lay on your side, and to me, there is no such thing as you must lay on your back or you must lay on your side. To me, both are good as long as you are positioned correctly. And correctly just means maintaining neutral.
So if I sleep on my stomach, but I have to take the one knee and really bend it up high, so do you think the fascia is twisted?
You are twisting your body. So here is the reason why sleeping on your stomach is the worst thing you can do. I joke about if you can figure out how to breathe with your head straight down facing the bed, then there's nothing wrong with it. But the unfortunate thing is when we sleep, we still have to breathe. And so guess what? You're laying in your stomach and the head has to turn in order to breathe. So now your head is twisted. Now the spine starts from here and it goes all the way to your tailbone, right? And so once it starts turning, it's going to twist the rest of the way. So now that you've mentioned that, if there is one thing, actually there's two things, but the one of the two common things that I encounter with people who have lived in pain for 20 years, 30 years, it's because they are stomach sleepers. That's the one thing. And then the second one is, believe it or not, if they've had a history when they were younger, they fell and landed on their bum. Okay, that's one. Or if they sprained an ankle, especially a big toe injury. A big toe injury is critical because it's the foundation. Our feet is the foundation, right, of the rest of the body. So when that is messed up, it will change the rest of us, especially because if it's hurting, you start limping. Okay. So I hope that helps.